All right, we're back. So I'm just going to pick up where we were there just before we left and talk about from static factors now on to the dynamic factors. So dynamic risk factors. Dynamic risk factors being ones that can be changed or altered through some sort of intervention. Right. So we looked at our client profiles in lab, what, 2 weeks ago? And yeah, about 2 weeks ago, and looked at the dynamic factors and sort of how to add or manipulate those, because these are the ones that the programming is based on. All right. So employment. So the value placed on literacy, employment literacy, education, work, and their role in a person's life. Job retention, as a person had a stable job for a long time, or if they had a number of jobs and never really been able to keep at one. Do they have training to be able to do a certain type of work or not, or whichever, right? So that is definitely a dynamic factor. We can teach employability skills. We can teach job retention. You can construct programs around employment that aid in a person's ability to maintain or find and maintain work upon release. So helping them understand the purpose and role and how to construct a resume, interviewing skills, all those sorts of things. Second being marital family as a target domain. So the value placed on being with family and the support one derives from one's family. Now we know that having a family and having those ties in the community is seen as a mitigating factor for future recidivism, as well as violent, as well as any offending in the first place, right? People who are more tied to community have more social bonds, and one of our primary social bonds is the family, are much less likely to harm their community. Again, you can put in program at provincial jail. We've got healthy relationships, and there's uh, relationship programming that is available through Correctional Service Canada as well. So associates, social interaction. So the value placed on non-criminal associates and the opportunity for positive social interaction. Again, this stuff is dynamic. It can be taught. It can be changed, right? So somebody who was quite gang involved before doesn't want to do that again, but doesn't know anybody else. Their best friends are all gang members. Everybody they know is all involved with that sort of subculture. So the value on finding pro-social outlets, like maybe joining into a recreational ball hockey league or baseball or slow pitch or whatever that's going to be, right? Something where they can meet people. It could be through a church-based activities. It could be through a whole lot of things to find associates that are more pro-social associates, and being able to identify between sort of the associates that are already existing in one's life, that are more high risk or low risk for that person. So quite often people have associates that were very much involved in their criminal offending before, knew what they were doing, may have been involved with it themselves, but they also knew people that weren't involved with that, and just how to recognize which relationships are more healthy and which ones aren't as healthy. Substance abuse. Obviously, substance abuse is very strongly linked to crime. So the value placed on living without reliance on alcohol and or drugs. And again, this is easier said than done. If just saying no worked, then the U.S. wouldn't have any drug or alcohol problems and they'd have a low prison population. Just say no doesn't work. It's not enough, because once somebody gets abuses substances, I don't necessarily mean addiction, but uses substances to be a core part of their social interaction with people, to get through life, to get through problematic areas of life, uses substances in any way that they need it for a portion of their life. That's a learned behavior, and that's learned very, very early on in life usually, and is quite a dramatic effect. So really it comes down to a whole lot of social skills training. There's a lot more associated with substance abuse than just saying no, right? And substance abuse programming is one of the biggest programs in all areas of corrections. So a few others: community functioning. So the value placed on having the knowledge and necessary skills for daily living being able to budget your money appropriately, right? Being able to be able to cook, clean, maintain a household, maintain a job. You know, those sorts of things all come under community functioning. Dealing with bureaucracies in positive pro-social ways, but effectively dealing with bureaucracies without getting frustrated and angry and mad and possibly violent, right? But people that have in the past, there was a guy, which I can't tell that story because he's pretty unique. But I've seen guys frustrated with various levels of bureaucracy, whether it be welfare, income assistance, EI, any one of those programs, and there's a whole lot tied to it, and they're not being treated fairly, and they recognize that, but they don't know how to effectively deal with that, to be able to talk to the upper management because things aren't happening properly or whichever. All right. So they end up acting violently, and it actually exacerbates their personal circumstances rather than helps their personal circumstances. Personal emotional orientation, so the value placed on being in control of one's life. Again, this quite often refers to mental health issues. So a person who maybe has ADHD, it maybe has a whole series, it could be a whole range of mental health difficulties, but we can target that and allow people to understand their need for um, uh, having taking their medications every day, recognizing the need for seeking help when things don't feel right. If they start having auditory hallucinations, or they start having delusions, being able to recognize that and seeking help rather than falling into to uh, more and more into their own mental health circumstances, and at a certain point probably not being able to get help because they've become so far gone. Attitude. So this is criminogenic attitude, right? The value placed on living in law-abiding ways. And there are interventions, there are programs that deal specifically with attitude, to not see the police in a negative light. If you've only seen police in a negative light all your life, then it's really hard to change that as somebody that you might be able to go to for help. So really being able to change the attitude around that, recognize the humanity in everybody, that bureaucracies, that criminal justice professionals aren't there to be mean or to catch people, they're there to help. Right, and that's where a lot of the attitude stuff comes from, and being able to assist people in recognizing a full range of responses, rather than pessimism and negativity towards uh, officials of all areas, bosses, co-workers, parents, as well as justice professionals. So the ratings then are low, medium, and high. And this is sort of how they work. Low needs quite often don't have any identified dynamic factors. So the range of answers within the risk and needs area go from the person actually doesn't have any difficulty, and the factor might actually be an asset. So the person's gone to jail, had a job, had long-term employment before they went to jail, and the job had nothing to do with their offending, and they're going to be able to go to that job again when they get out, right? That job option is still available to them. There's no it's not even just a low need. The factor is actually seen as being an asset, so it's scored as factor as an asset. The other one would be no difficulty, or no need for improvement, depending on again the scoring that's done there. Then there'd be some need for improvement to considerable need for improvement. And considerable need for improvement really requires those larger interventions. So somebody who's a chronic drug addict, when they came into jail, would be seen as having considerable need for improvement in their substance abuse domain area. And somebody who came in and had been a Buddhist and never drank or done any drugs in their life, I'm just not picking on Buddhists, that's one of the things there. They could have just been anybody who's never drank or done any drugs in their life. Factor would be seen as an asset because it's not going to be an area of difficulty, or become an area of difficulty. So relatively few identified dynamic factors would be rated as some need for improvement. So high needs, very few identified dynamic factors, but those needs being a considerable need for improvement. And a considerable need for improvement could only be in 3 areas, but they could be 3 very significant areas that were directly related to the person's criminal offending, right? So they could still be seen as high needs because those 3 areas are incredibly high needs, right? So multiple dynamic factors are identified regardless of degree or severity of need. So you could have 3 of the dynamic factors that score very, very high and still be high needs, and the other ones just being sort of not seen as assets, but lower need for improvement. Or if you have some need for improvement across all areas, they could still be seen as being high needs. So the ratings continued. Medium needs, again, medium is a balance and it's done on a score sheet. Any combination of dynamic factor severity, and they sort of range between high and low in a bunch of different areas. They might have some areas where there's dramatic need for improvement, such as substance abuse, but we have factors seen as an asset in an area like employment. So they would end up being medium needs overall. So the classifications end up being high risk, high needs. If a person's rated as being a high risk to the community, high needs, so lots of interventions needed. They're going to be, that's how they rate. They don't actually rate maximum, medium, minimum. Those are custody rating scales, and that's a separate assessment that's done. This is for setting up a person's correctional plan through their whole system, how you're actually going to case manage the person, not necessarily the custody rating scale. The maximum, medium, minimum is strictly about penitentiary placement and doesn't really have a ton to do with the management of the case. The case managers are going to be focused on this area specifically. What's the risk? What are the needs? If they're both high, how can we introduce interventions that can assist with that? So high risk, high needs, obviously medium risk, high needs, medium risk, medium needs, medium risk, low needs, all right, and low risk, medium needs, low risk, low needs, right? So the needs and the risk on dynamic factors can all be addressed through programming, and this is how people are classified, and this is how all their correctional plan progress reports afterwards are basically start with this. Where does this person lie? So they lie medium risk, low needs, then they explain why the person's still medium risk, why a person's still low needs, what further interventions are going to occur to try to bring that risk level down, whichever, right? So the types of assessments. So the assessments are done on educational level. So and not just measuring in general education, is this person literate or illiterate or whichever, but actually saying what grade level are they at, and taking it from there on writing, arithmetic, because they could be quite varied on each of those things. The severity of any addictions the person might have, their abuse history, so where they've inflicted abuse on others, use of violence, what sort of use of violence, the severity of violence, the strengths, as person strengths. So assessing what are this person's main strengths, and there's assessment instruments for that. Psychologist reports regarding mental health. They also address a few other areas, anger issues, abuse history, personal abuse history there, usually. And risk to offend, if especially seeing if it's a violent risk to reoffend or a lower risk to reoffend or a non-violent risk to reoffend. So the use of assessment info informs the intervention strategy. So what programs this person needs to do to complete their correctional plan. To determine their institutional placement, so the custody rating scale. There determines access to programming, whether they're who's a priority for programming or not, and to give insight to the offender about their own needs. and to provide the case management team with insights. All right, I'll end you there.